Turn back for Thursday night to Friday, more clouds and rain expected. High temperatures for Friday, about 68.
The views expressed on this program are those of the host, guest, and callers and are not necessarily those of KKNW, its management, or other advertisers. This program is sponsored by Dental Med Alliance, LLC.
Good morning, I'm Dr. Jessica Saepoff, and you're listening to Dental MD radio show. And I've been on the radio for about 8 years now and doing a lot of one-hour shows on various topics in dentistry. I've been practicing dentistry for 30 years and 20 years in the Western Washington area. So I've been practicing my profession according to the principles of natural medicine for about the past 25 years. It took a few years coming out of school to incorporate the principles of natural medicine. I was always, since probably teenage years, a holistic thinker. So thinking about how one thing that I do could affect other things, such as, supplements and nutrition and how that affects the body, how what we eat or don't eat affects the body. And, back in the 70s, that was probably, when that way of thinking became more popular, more well-known. And it's sort of come and gone in popularity since then. These days, there are natural medical schools, such as Bastyr and others, that train physicians, and when they come out, they have an ND, or naturopathic doctor degree, and they have a medical degree. That is a medical degree. It's not an MD, medical doctor, like the allopathic, but and they're probably limited in how much surgery experience they have, that kind of thing. But it is a 4-year postgraduate degree, and it is a doctorate, and they are doctors. And the main principles of natural medicine that I use in my practice of dentistry is using the least toxic materials that are available, and really researching to see what is the least toxic, not just saying, the American Dental Association approved all of these, and so I can use all of them. But actually looking to see what a little bit higher standard than that for cytotoxicity can be applied, and has been applied by some companies that make dental materials. And so having researched all of that, the materials that I've selected for use at my office are pretty carefully screened and studied, researched before they are put on the market. And then, I've checked to make sure that cytotoxicity studies are included in the materials that they send me when they want to tell me about the material. They're not just telling me that it's ADA approved, whatever that means, and that it's easy to handle and looks nice once it's in the tooth, matches the tooth color. All of those things are important, but they're not everything. It's also important to compare the different types of plastics and choose the ones that are the most compatible. And there are still no natural dental schools in existence. All dental schools are allopathic. They are Western medicine oriented and not natural medicine oriented. So besides using the least toxic materials, the other main principle is to do the least invasive possible intervention first to see if that works. And obviously, if the situation is already urgent, then you have to use the appropriate level of intervention for that problem. But when you have a problem that is not urgent, rather than doing something very aggressive, I prefer to start with procedures and ways of approaching the problem that are less invasive. If it's possible to remineralize something, then I'm going to coach the patient on how to try to remineralize the teeth before they become cavitated or have holes. I'm going to help people learn to do this and practice it at home and then recheck things. Anyway, that is less invasive than just jumping in and drilling and filling. So that's my way of understanding how to practice dentistry using the principles of natural medicine. Today's show is primarily going to be about gums, periodontal disease, used to be known as pyorrhea. So you might have heard that term years ago, and mostly people just refer to it as gum disease, but the official term for it is periodontics. So there are still no natural dental schools. All dentists that are practicing holistically or according to the principles of natural medicine, they might also call it integrative or biological dentistry. All of us have learned this outside of mainstream continuing education, continuing education, or other training. And so every holistic dentist, we're not very standardized. There are some groups that are trying to standardize holistic dentistry, biological, integrative, whatever term you want to use, to try to get all holistic dentists to do everything the same way, which is the same thing that the American Dental Association and the insurance industry working with them are trying to do for mainstream dentistry. They want everybody doing everything the same way. If you say you are a dentist, then people should be able to expect when they walk into any dental office to get treatment, certain diagnostic testing and treatment, and they want it to be pretty much standardized and all done the same way by everybody, with the only differences being the personality of the dentist, demeanor, that kind of thing, speed maybe. And in holistic dentistry, still at this point, which I think is a good thing, every holistic dentist has learned different things along the way, and each of us practices quite differently. So I just wanted to state that, because the best thing that you can do as a patient is call more than one dental office and get an idea by talking to their front desk, or maybe going in for a second opinion type of appointment, just to meet the staff and the doctor and see whether you feel comfortable with their philosophy and their way of doing everything. And yeah, you're pretty much going to know whether you are comfortable in an office. And it may mean that you have to try more than one dental office to find one that seems to fit with your philosophy, because patients are not standardized either. Every patient has a slightly different or very different level of knowledge about natural medicine principles and how they apply them in their life. Some things that you want to apply are extremely expensive and get put off, and then things become more urgent after a while. And it's not always because of neglect. Sometimes it's because the choices that are available are not to your liking, and so things get put off for various reasons. So when you come into my office, there's no judging. There's no judging. And whatever you have going on at that moment when you walk in, that's what we're going to take care of and address. And people have all kinds of reasons why the situation in their mouth has become the way that it has. And, there's no blaming or shaming involved. It's just, and I'd like to hear your story on how it came to be that way in your mouth and what your priorities are and whether you're having sensitivity or pain. And then we're going to look at how to solve it and how to keep it from happening again also. All right. So today I am going to talk about periodontics, which, as I said, is gum disease. And gum disease is one of those areas of dentistry where, it's for a while, you're not going to notice that something bad is happening because it's under the gums and easy to mask, easy to ignore, and it doesn't hurt usually. I've actually, not in the holistic office, but years ago, before I was working as a holistic dentist, I actually had a patient walk in and hand me a tooth and say, "This tooth fell out last night." And this is an adult, not a kid. The tooth fell out. They unwrapped a tissue and showed me the tooth. And I did an exam, and most of the rest of the teeth were about to do the same thing. So and so it can get very, very advanced and still not hurt. I mean, it really can get all the way to where your teeth are coming out. That's why it's very important to get regular exams and make sure that you are not developing gum disease, because it's a silent way to lose teeth. And it just usually gets worse and worse over time because it's happening down deep under the gums where it's hard to reach. So, help and training in preventing it and treating it if it's already happening and keeping it from getting worse. Very, very important. Very, very important. And during this show, I'm going to talk about what to look for with children's gums and what to look for in adults for signs of gum disease and gum problems. All right, you are listening to Dental MD. I'm Dr. Jessica Saepoff. And if you have questions about today's topic or any other topic that I've talked about or haven't talked about, give us a call at the Issaquah office, 425-427-8899. And you can also reach the front desk by email, appointments@naturaldentist.com, and get your questions answered and find out if we are the practice that you want to go to have an exam and treatment. All right, I'll be right back after this break. This is the Dental MD radio show. listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about periodontitis, which is gum disease, periodontics. And I have covered in the previous segments, I talked about pigmentation, abscesses, injuries, impacted food, trauma, allergies, and juvenile periodontitis, which is severe and aggressive gum disease in teenagers, much younger than what you would expect. Now, I want to talk about what happens when adults have pocketing, because as an adult, you go into the dental office and they check all the teeth, they check all the tissues, the jaw joint, airway screening, whatever they're going to do, and then they also check your gums. And they do this two ways. One is by measuring recession, and that is just to see whether you have roots showing, and your roots might have abfraction lesions, which are indentations from, some people think it's caused by brushing too hard, but actually it seems to be more likely that it's caused by mechanical pressure on the teeth. And that happens when you clench and grind, and it happens on usually worse on the teeth that are rotated or out of position. So sometimes doing orthodontics to position the teeth correctly so that they meet in a way that sends the forces directly up the roots where it belongs instead of sideways, which causes these mechanical indentation lesions along the gum line. And they can happen on the inside gum area or the outside of the tooth, depending on which way the tooth is being pushed when you're clenching. So the recession is one of the things that gets measured, and a lot of times people confuse this with the measurement of the pockets. When the pockets are being measured, that's when it feels kind of pokey sometimes, because they take the little millimeter measuring tool called a probe, and they slip it down along the root under the gum, and when it touches the bottom of the pocket, which is where the periodontal ligament is tightly attached to the tooth, to the root, right there when the instrument touches bottom, we take a measurement of where the gum tissue is, and that might be, if it's 1 millimeter, 2 millimeters, or 3 millimeters, that is considered a normal reading. That is a sulcus, not a pocket. So you're supposed to have a sulcus. That's a little indentation right along the gum line. And that's when you floss and you put the floss down and the floss disappears a little bit underneath the gum in between the teeth. That is the floss dropping down into the sulcus. And it can get down about 3 millimeters, and 3 millimeters is about as deep as a normal sulcus should be, 1, 2, or 3 millimeters, depending on which tooth and where in your mouth. All right. If the measurement is a 4 or greater, then you now officially have a pocket. Now, 4s are kind of a warning sign. They're not a deep pocket. They are a mild, very mild pocket. And sometimes 4s can be very stable if they're kept very clean and they don't progress, and it's just maybe a tooth is tilted a little bit, and so that gum tissue is a little taller on that side, and you have a 4, or the tissue is a little taller in the back where a wisdom tooth used to be, then that might be a consistently measured as a 4, and that is just an extra deep sulcus area in somebody who has never had gum disease and just has 1 or 2 4s in areas where the gum tissue is a little bit taller and it's cleanable and it doesn't progress. But 4s have to be watched because the bacteria that live along the gum line can get down, and if they get down to the bottom of that 4, they can be very hard to control and clean out, and they can be irritating. And what they will do if they get down underneath the gum tissue, either at a 3 or a 4 millimeter depth area, they will begin to irritate the tissues. And when the tissues get irritated, the ligament that is holding the gum tissue against the tooth will begin to break down. It gets weak and it starts to relax. And then the bacteria say, aha, let's go down another millimeter. And then they keep moving in and keep irritating the little ligament, and the ligament gets lax, and then they move in a little deeper. And before you know it, you've got 5s and 6s and 7s. This is millimeters of depth. That means the bacteria are living 7 millimeters down under the gum on the root of your tooth, where it's dark and there's no oxygen, and you end up with anaerobic bacteria growing down there. Those are the ones that do the most damage and smell bad. So sometimes bad breath is because of pockets that are deep enough to harbor anaerobic bacteria, among other things, parasites, amoeba, spirochetes, all kinds of nasty microbes will find a happy home undisturbed under the gums deeper than 4 millimeters. Okay, now 4 millimeters these days us around the gums, which we custom make for people.